Today we're going to be talking about a very challenging topic. It's about miscarriages, specifically babies born after miscarriages. I want to put a positive light on it. But despite it being the holidays, despite it being just a few days away from Christmas, there is a very important topic that many people come in for, which is miscarriages. As a doctor of acupuncture and Chinese medicine, this is not a topic that we skirt around. This is a topic that's very important in our medicine. And what I want to share with all of you is that every acupuncturist, every person who practices Chinese medicine on this planet, if you go to us, any acupuncturist on earth, they will look at your paperwork, look at you physically, and they should have a clear answer why you had one or more miscarriages. Some people will know, some doctors and practitioners will know immediately, and some doctors and practitioners will take some time to really understand why you had one or more miscarriages to begin with. And why am I sharing this? Because currently in my practice, there are quite a few women who are working with me for fertility, and they have had miscarriages, or at least one. And it's a topic no one really wants to discuss out in public, but it's so important. And women, many women do benefit from talking about it, and especially if they're seeing a therapist. But what we do here is we listen to our patients and we do something about it with Chinese medicine, with acupuncture, with herbs, primarily. I'm talking about this today because the newsletter that I'll be making for Elements in Harmony, Acupuncture.com, it is right now, today, December 21, 2023. I've thought about it for the last few days, and I am compelled to write a newsletter specifically on the success stories that we've had since, that I've had. I've been in practice since 1999, and I haven't received Yelp reviews since 1999, but definitely since at least 2007 or so. I started making videos in 2006, just telling people about our work here, my work in particular. I want women to know that there is hope, whether you had your miscarriage in the first trimester, second trimester, or near birth. It's a very sad story. There's no other way to. There's really how it's it's a very delicate topic, but it is so important that we talk about it. It's so important that women know that you're not alone. You know what? I'm going to look up how common are miscarriages in the U.S. And I haven't looked this up until just now. Miscarriage is very common. Some research suggests that more than 30% of pregnancies end in miscarriage, and many end before a person even knows they're pregnant. Most people who miscarry go on to have a healthy pregnancy later. What is a threatened miscarriage? So that's the first thing that I found on March of Dimes. I just Googled it. So, what's the next thing? How common is miscarriage in America? And then there's up to 1 in 4 pregnancies ends in miscarriage. So that's the first time I looked it up. You'll see in my videos that I say frequently that my miscarriage rate is extremely low. And that's because I have fertility down to a science. So I don't want to go on and on about this. I just wanted to share that the next newsletter is going to really be geared towards pregnancies, powerful pregnancies that ended in powerful deliveries, beautiful deliveries, and strong, healthy babies. And these success stories are primarily going to be from women who've had miscarriages. women that I helped get pregnant and women that I helped during their pregnancy, and both. There are women who come in to want to get pregnant, and there are women who are already pregnant who want me to help them carry to full term, and there are women who do both. They had a miscarriage, I help them get pregnant, and then they also see me during pregnancy. I specialize in the most challenging fertility cases. If you want to know what that means, you can make an appointment. I can give you some examples via text, 619-341-4341. I'll send you like 1 or 2 examples. I also specialize in the most high-risk pregnancies. And Mother Nature has her way of making sure that the babies who are born strong, healthy, vital, vibrant, powerful. And that is the goal, is to make you a perfect baby palace so that when you are pregnant, you can have a full-term pregnancy. I gave birth at 30, 36, and 43. All 3 were conceived naturally, and they were 7, 8, and 9 pounds respectively, and that was by design. The second and third pregnancies, 36 and 43 years old, I treated myself almost daily because I can. Because for me it's free. Because I can just stick some needles in myself. I want those of you who really want to become parents, and if you want to conceive naturally, I've been in practice since 1999. It wasn't until 2019 where I opened my doors again to women who wanted to get pregnant with IUI or IVF. 2008 to 2019, I only focused on natural fertility. That's a long explanation, and it's in some of my videos. When we're working on fertility, we want to make sure you are a perfect baby palace, and that's why you want, that's part of the explanation why I'm not in a rush to get you pregnant. My focus is not to get you pregnant. My focus is to make sure that you are powerful, you are strong, you are healthy, so that when you carry your baby, you're carrying for 9 months. The average woman, my understanding is the average woman gives birth at 41 weeks in 1 day. For my doctorate, I followed an amazing OBGYN. I believe 37 or 38 weeks is the bare minimum. But, we try with the midwives that I work with, and some of them do OBGYNs that I work with, we're trying to go to at least 40 weeks. So if you want to, really strengthen your ability to conceive and carry a full-term pregnancy and deliver a healthy, happy baby, check us out, elementsinharmonyacupuncture.com. I specialize in the most challenging pregnancy cases, fertility cases, and high-risk pregnancies. I have some people who work with me, some amazing doctors that work with me. They can see as well. The rates are not different, but that's not their specialty. So I strongly recommend that you see me when it comes to the most challenging. You're definitely welcome to see any of my doctors. Just know that if you've never seen me, I charge the initial rate, whether you've seen one of my other doctors or not. The initial rate for fertility, I need to, we need to sit down because I need to know the whole story. I can't hear it from one of my doctors. So if you're coming in specifically for fertility, I strongly recommend that you see me, and we will be very thorough, and you'll know what my protocols are so that you can, have your dreams come true. All right, my name is Dr. Anna Dolopo, elementsinharmonyacupuncture.com. You can text 619-341-4341. Our office number is 949-305-1703. Thank you. Take care.